Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey there, welcome to the Stay Healthy El Paso podcast. I'm your host, Dr. David Midoff, physical therapist over at El Paso Manual Physical Therapy. And today I'm going to talk to you about wrist pain. Specifically, I'm going to give you the top 3 reasons for wrist pain. Now we're talking about wrist pain that began without some sort of big injury. Maybe you had an injury a while back or you had a slight sprain or strain somehow on your wrist, but nothing that stopped you in your tracks. There was no break, nothing where you had to go to the doctor and get x-rays, and it's still bothering you. It's still hanging out. It's become chronic even. That's the kind of wrist pain that I'm talking about, and then I'm going to share the reasons for that type of wrist pain happening. You know, in the medical community, this is one of the most confusing things to treat. Oftentimes, physicians just recommend braces and pain medications, and that really doesn't fix the problem for the long term. It's just a short-term solution. So we're going to go into the top 3 reasons for wrist pain. The first reason is a stuck wrist joint. Now, in the wrist, there's, of course, from your forearm, there's 2 bones in your forearm. One is called the ulna and the other is called the radius. Those are the ones that start at your elbow and then they go down towards your wrist. And the radius is the one that's wider at the wrist. It connects to 3, some people would argue 4 bones directly. So it has connections to 4 little bones that are called the carpal bones. And they're called carpals because they're shaped like little pebbles or rocks. And they all kind of move on each other freely. And there's another row of carpals right after that. So you actually have 8 carpal bones before you get into the actual long bones of the hand, the ones that look more like fingers. Those are called the metacarpals. And then you have the phalanges, which make up the actual fingers themselves. But all those little bones within the wrist can get stuck on each other. And oftentimes that's one of the main reasons why people have wrist pain, especially the type of wrist pain where you're fine when you're not moving, but then you go to grab something or you twist your arm or move your wrist in a certain way and it just bites you real hard and you have to kind of stop or grit through it. That almost always is a stuck wrist joint. And that can be fixed. That's something that at El Paso Manual Physical Therapy here with our manual therapy treatments, we can actually go in and find the bone, the joints that are stuck and free them up, and then teach people how to keep them free for the long term. And it's almost magical whenever we get a patient that comes in here and they have been suffering with a wrist problem, they've been wearing a brace, they've been doing all kinds of things, and then we go in and we we're able to find the joint and poke it where it hurts, and they're like, oh, yep, that's it, that's the one that hurts. We'll move their wrist in a way that we know the way the bones move, so we'll move the wrist in a way that sets it off, and they're like, yep, that's it, that's where it hurts. And then we fix the joint, we get it moving better, and then they can move their wrist normally again. Now, it's not quick as far as, it's just one treatment and it's over. We can free up the joint in one treatment. Usually there's a few more that need to happen in order to keep the joint free for the long term. But there's also exercises to do to make sure that those joints aren't getting stuck over and over again, because that will happen if we just simply free up the joint and not do exercises to make sure that the space around the joints is normalized, the forces on the joints are normalized, then that problem will likely come back again, and that individual can keep getting stuck wrist joints. The second most common reason for wrist pain is weak grip muscles. Now, all the muscles in your forearm, almost all of them, are dedicated to moving the wrist and hand. Now, the ones on the front side of your forearm, the part that's on the same side as your palm, are focused on closing your fingers to form a grip. And the ones on the opposite side, on the side of the outer elbow where the point of your elbow is, those are the muscles that are focused on opening your hands. Now, the muscles that close your hand are much stronger than the ones that open your hand. I think of it this way. I was a I'm still a nerd, but I was always a nerd even as a kid, and I used to watch the Discovery Channel, and I loved watching Steve Irwin, the crocodile guy, and rest in peace. He's a great guy. His kids are actually coming onto TV doing great as well. But I'll never forget watching Steve Irwin wrestle a crocodile, sit on top of it on its neck, and hold the jaws of the crocodile shut with his bare hands. And then he explained how the muscles of the crocodile's mouth are very, very powerful and strong closing, because they have to be able to crush things and bite things and hold on to their whatever they're going to eat without it letting go. But the muscles to open the mouth are not very strong, and he can actually hold them shut and overpower them with his bare hands. I thought that was so cool. But it's the same thing with your hand. If to open your hands, the muscles that open your fingers are very weak. That's normal. That's the way they're supposed to be. You actually don't have to train them very much. But the ones that close your hands are supposed to be much more powerful, and oftentimes that's a big issue. We see people that have very weak grip strength, and that causes them to have some sort of wrist problem. It might affect the joints, like I just described, as one of the number one reasons to get wrist pain. But if that grip is very weak, it can definitely change the way that other things are moving within the wrist, not just the muscles, but there's tons of tendons in there. There's some cartilage in the wrist as well that is important to be in a certain position and to move right. And the muscle strength of the grip can be a big factor. And it's not as straightforward as just going to go get a grip ball. I mean, you have to have some serious grip strength. Some people need to have grip strength over 100 pounds of force. If you think about it, that means that person should be able to pick up a weight that weighs 100 pounds and hold on to it, not overhead or even straight up in front of them, but at least dangle it within their grip and be able to sustain it. That would be 100 pounds of grip strength. So you can go backwards or forwards from there. Some people need to have 120. Some people need to have 70 or 80. Generally, as you age, it's acceptable to have weaker grip strength, but I'm always from the angle of, if you're in here in my office and you're having a wrist problem and you're 80 years old and your grip strength is normal according to your age group, well, we got to get it higher to make sure that wrist pain does not ever come back. I want you to have the grip strength of a 50 or 40 or 30-year-old so that you're not dealing with any wrist problems as you go into your 90s. So grip strength is a big, big deal, and there's different ways to strengthen it. The easiest way that you can do this at home is to go get yourself a grip strengthener, the ones that have the spring on them. I especially love the adjustable ones. They have a knob with the spring on there, and you can work your grip strength with that. The third most common reason for a wrist problem, this may not make sense to everybody, but neck and shoulder problems. The reason for this is if somebody has a neck or shoulder problem, of course all the nerves that come off the spinal cord exit the neck right in the neck area, and then they go into the shoulder. They go under the collarbone into the shoulder, and some of those nerves go all the way down into the arm, past the elbow, into the wrist, all the way to the fingertips. And it is very possible, it happens way more frequently than people think, where their wrist problem is actually coming from their neck or their shoulder. And I've had it probably about close to half of the patients that come in here, we're spending quite a bit of time for the wrist problem. We're spending quite a bit of time working on their neck and shoulder, and that is the bigger factor in clearing the wrist problem up. So it's surprising with patients. I have to kind of sell them a bit on the idea of it, because they're like, "Oh, do something to my wrist, fix my wrist because that's where it hurts." And I have to tell them, I know, and we'll do something for your wrist, but we need to really focus on the neck. Otherwise, the wrist won't get all the way better. You're only looking at a 50% or less improvement if the majority of the problem is up in the neck and shoulder region. So consider, if you've got a wrist problem right now, is your neck also stiff? Is your shoulder stiff? Can you pick up both arms up all the way evenly? Do you have a history of shoulder or neck problems on the same side as your wrist problem? What side do you sleep on? Are your shoulders even? Because some people are lopsided. They can't turn their head all the way to one side versus the other. These are all signs that you've probably got a neck and shoulder problem, and that could be contributing to that chronic wrist problem that you're dealing with and are looking for help with. Thanks so much for listening to this podcast, guys. Wherever you are, I'm happy that we can provide this so I can get into your ears, whether you're driving in the car or working out or just at home doing chores. I love the podcast here. I think I listen to podcasts so much. I think it's such a great alternative to radio. Of course, no commercials, on demand. I love so many aspects of this podcast. And one of my favorite things is I can find things that are very specific for what I'm looking for, very much like you might be looking for wrist help. And, we got this podcast for you. So do me a favor. If you thought that this was helpful for you and beneficial, please give us a 5-star rating on whatever platform you're listening to this on, whether it's Apple or Google or all the other podcast platforms that we're out there on. Give us a rating. That helps us get a little boost from the platform so that other people can find us and get helpful tips to make sure that they're avoiding surgery, injections, and medications. One of the worst things that people get for this chronic wrist problem is carpal tunnel surgery, and it's highly preventable. Oftentimes, it's a neck and shoulder problem that's leading to that carpal tunnel surgery issue. And unfortunately, we see a lot of people that have had carpal tunnel surgery and then they're back here in our office because they still haven't gotten it resolved because it wasn't a wrist problem as much as it was a neck and shoulder problem. So those reviews would be helpful for those people so that they can get the help they need. I don't care about them for myself. I could care less, really. I just want to get people helped. So leave us a review, please. And we look forward to talking to you again real soon. Have a wonderful day. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.